Morning, everyone. This is Dr. Julio Gonzalez reporting live from the American College of Rheumatology meeting in San Diego, California. And it's been a great congress so far, especially in the topic of psoriatic arthritis. We've heard great articles, and I'd like to continue that trend here. I'd like to report a couple papers that have been published, actually 3 studies on the topic of psoriatic arthritis and radiographic progression. The first one is a late breaker that was just presented this morning. It's a Future 5 study on secukinumab. This is a very large study, 996 patients that were randomized to receive either 300, 150 with loading and 150 without loading, 300 with loading of secukinumab. These patients were around 30% of them were TNF failure, so those patients were included in this study. The study was carried out to 24 weeks to monitor structural progression at 16 weeks as expected, and secukinumab had better scores as compared to placebo, and at 24 weeks radiographic progression was significantly inhibited in secukinumab as compared to placebo. Okay, the second study I want to talk about is on another IL-17 inhibitor, this time ixekizumab. There was another study, this time carried out to 52 weeks. This study was presented by Dr. Van der Heide yesterday, and they showed that at 52 weeks in both the every 2 weeks and the every 4 weeks doses of ixekizumab, radiographic progression was halted significantly. These patients were initially on either placebo or adalimumab and were switched to ixekizumab, and then they got the measurements at 52 weeks. The third study that I want to talk about on radiographic progression is on tofacitinib. So this is a lot of news around this in the field of psoriatic arthritis, and this study was interesting in the way that they had an adalimumab arm up to 52 weeks, and they also grouped their patients between CRP levels, so patients with high CRPs and patients with low CRPs or normal CRPs. What they did is that they looked at the radiographic data at 52 weeks, and what they saw was significant diminishing or halting of progression at 52 weeks in the 3 arms, the TOFA 5 BID, the TOFA 10 BID, and the adalimumab arm. So as expected, up to 52 weeks, diminished radiographic progression in the 3 studies. So great news in the field of psoriatic arthritis. We keep hearing good things. It's been a great congress for in this field, and specifically we're anxiously waiting the release of the new American College of Rheumatology and National Psoriasis Foundation criteria for psoriatic arthritis today at 1 p.m. So if you're here, make sure to go check it out. And if you want to learn more, make sure to go to rheumnow.com to get the latest and greatest information as it happens.